Hello, my name is Annalise, and I am a occupational therapy student. Today, I have a presentation over role changes post-stroke. So just sit back and enjoy the ride. So for today's objectives, I want to define what a role and an identity is. I want to explain the changes that occur after a stroke, and I want to identify ways to reclaim these roles. I also want to go over tips for caregivers and survivors to help promote these roles. So, why talk about this topic? Since my time here at the American Stroke Foundation, I have noticed the importance of roles and identities. When someone has a stroke, there can be a major disruption in a person's identity and the roles they perform. I've spoken with many of the participants here at the American Stroke Foundation, and I have learned a lot from them. In occupational therapy, we strive to ensure individuals are living to their highest potential, which we call quality of life. We want to make sure our patients and clients are able to engage in their meaningful activities, and roles play a large part in that. So it's important to discuss this topic with you guys. So first, let's define identity because it helps narrow down the roles a person may perform. So identity is defined as an individual's sense of self, defined by first, a set of physical, psychological, and interpersonal characteristics. This could mean being short or tall, being a leader or a team player, for example. And second, a range of affiliations and social roles, which could mean ethnicity, for example. Now let's define roles. Roles are defined as a set of behaviors expected by society and shaped by culture and context. They are further conceptualized and defined by a person, group, or population. And most importantly, roles help with our identity. For me, being an OTS is a role that I play, and it means, to me at least, being open minded, empathetic, and creative. So, all those qualities that I have for my role of being an OTS have been added to my identity. Now, I want to go over some common roles a person can have. So, listed below are some common roles we all can have. It's important to note that all these roles shape ourselves, like I mentioned earlier. Now, this is not a complete list, but it should give us a good idea about the multiple roles one single person can have. Now, let's talk about the effects of a stroke. I have listed 4 main points, but I want us to focus on the one highlighted. So, first, we notice that there can be emotional changes that occur after a stroke. For one, there can be grief after a person has experienced a stroke. It can be a long process and it's different with everyone. Other emotional changes could be depression and anxiety. Remember, not everyone may experience these changes, but it is common for those who have had a stroke. Now, there are also physical changes that a person may have. Some common ones can include vision problems, weakness on one side of the body, and balance and coordination problems. These changes can be quite visible for the person, and it can really show what has occurred after a stroke. Now, there are also mental changes that occur after a stroke. A person's thought process can change as well as their awareness. Some individuals may have trouble with their memory or their ability to communicate. A common one that we see is aphasia, and we know this is a condition where a person has trouble speaking or understanding what is said, or a combination of the two. However, we know that this does not mean a person is less intelligent. Lastly, there are changes to a person's everyday life. This is where roles and a person's identity really come into play. Essentially, having a stroke can prevent a person from carrying out roles they previously performed. For example, after having a stroke, a person may not return to work. Therefore, their role as a worker is now unavailable to them. This can cause major disruption to a person's identity. Now, with all this being said, I want us to look further into who we are. Earlier, I listed some common roles a person can have. Now I want to elaborate on this concept. For example, I am an occupational therapy student. Sometimes I think this is the most important and only role I have in life. Yet that's not true. I'm also a daughter, a sister, a friend, a dog lover, and so on and so on and so on. As you can see, I have many roles in life, and all these roles shape my unique identity. Furthermore, our roles and identities change over time. This is because we are always changing and growing. For example, I didn't always have the role of being an OT student. So you may have new interests since your stroke, or you may want to get back to doing things you used to do. And this leads into our next point of identity being a choice. What I mean by this is that you can decide who you want to be in life. Now, this shifts a person's thinking of who they were before their stroke to who they can be in the future. It's about looking at the things a person can control. For example, you may not control how much strength you get back in your affected limb, but you can control how much hard work you put in to regain that strength. This is really an important concept that I really want you guys to focus on, deciding who you want to be in life. So now that we have gone over those three things, let's look at the deeper meaning of our roles. So we need to figure out why we loved a role. For me, I love being an occupational therapist because on being an occupational therapy student, because OTs focus on clients engaging in occupations that are meaningful and necessary to that unique individual. So that's why I love my role as an OT student. For others, it could be, any of the other roles that we have mentioned. Therefore, it is important to find different ways to express your roles. And this is all about finding new ways to help reclaim your identity. For example, if you were an avid baker, teaching a loved one to bake a cake will allow you to express your role as a baker. And it can be an even greater role as you are now passing along your knowledge to another so they can share your passion as well. So, speaking of passing along knowledge, sharing your story with someone can allow you to express yourself. Everyone has lived a unique life, so it can be beneficial for you and the listener to have a conversation about yourself. You can explain all the roles you have done in your life, and you can talk about your plans for the future. So, to put these ideas into action, I have some tips for survivors and caregivers. First, communication is key. Both you and your loved one need to be on the same page. So just communicating and explaining the rationale for doing certain tasks is really important, especially in our everyday lives. Another thing to emphasize is strategizing ways to explore new or previous roles. Brainstorming ideas on how to perform activities that fulfill certain roles can be very satisfying. So, survivors should have a space to try these new ways of expressing themselves. It's really important to make this a safe space and to give yourself grace and just be patient when you're trying to figure out the best way you can partake in previous roles. So, it's important to prioritize self care for you and your loved one. This could mean different things depending on your personal needs. For example, I make sure that I have some alone time where I can read a good book when I'm feeling overwhelmed or frustrated. And it will just depend on what your guys' needs are. And prioritizing self care is going to improve your role performance in the future. So, in conclusion, I really want to emphasize these takeaway points for you guys. First, your identity is shaped by the roles you have in life. Your roles can change in life. You can still engage in previous roles after a stroke, like we talked about. It could be in a different way, but it's still possible. And just working together with your loved ones on reclaiming roles is key to making sure that you're able to partake in the things that you like doing. So that is all I have for you guys. Thank you guys so much. And here are my references.